What can we do for you?
Okay, very simple. I have a hemorrhoid, and it's excruciatingly painful. Yes. Yesterday had some spots of blood on toilet tissue.
Okay, you've had these before, presumably, or
Many years ago.
right?
Yeah.
And you're fit and well otherwise.
Yes.
Should we have a look?
You can. Yeah, I've had a shower.
Fine.
I'm going to Italy next week, and I just thought, please go.
Yeah.
Just go before I go to Italy.
Oh yeah. Okay. I'm just gonna. Just tell me to stop if it's too tender. I'm just gonna put a finger inside. There's a nasty pick. It doesn't actually look like it's thrombosed yet, which is what happens sometimes when they get sort of clotted and then they become sort of almost permanent. Right, you get yourself dressed up and decide what to do. Now, when are you going away?
Tuesday.
There is a sort of rapid access, or sort of piles clinic, if for want of a better word, that runs at St George's, but it's on a Thursday, as far as I remember.
I'll be gone.
Be gone.
Yeah. Yeah, I'm going to, we're going to southern Italy, Bari, do you know it?
I don't know. Sounds nice, though.
And whilst we're there, I'm proposing, so we shall see.
So you really want these under control, don't you? Is it all planned then? Have you got a?
Yeah, bought the ring. I thought I'd just go for a nice stroll across the beach and then just go down on one knee as the sun's coming down and see if it all goes well. And if it doesn't, she's going in the sea.
Okay, so I think the thing to do really at this point is to treat it as much as you can.
Okay.
Now, it's on the sort of anal verge, so it's partly in, partly out, and as far as I can examine, there was a suggestion of some little ones slightly higher up as well.
Right.
So what I will give you is some suppositories.
Yeah.
And some ointment as well.
Okay. So what do I do with the suppositories? Just push them off? Delightful. Right, okay.
All right.
Yep, thank
well,
you.
I hope it settles down.
Okay, wonderful.
All right.
Okay.
Bye now.
Have a good day.
And you.
What can I do for you?
I have a mobility issue in my right hand.
Okay.
I'm an office worker. Typing's becoming incredibly difficult, really quite painful. It's kind of something which has evolved over the last 6 months. Keeping it really simple, left hand.
Yeah.
That's it fine. Right hand is just have very limited mobility in it.
Okay. And what's the origin of that?
I don't know.
Okay.
I'm typically male, typically lazy about coming to doctors, all of those things.
Are you left or right-handed?
Left-handed for writing, but like right-handed for sport.
Okay.
The thing I'm wondering is I've learned golf this year. Don't know.
You have enough dexterity to do that, so to grip the club, but
I just noticed pain
typing.
Occasionally.
Do buttons up and stuff?
Doing my cuff is a lot harder.
Yeah.
But I can do it.
Have you noticed it with anything else? Tying your shoelaces?
No, shoelace is fine.
Would you mind just
Of
tying your
course.
shoelaces for me?
It
While I'm
won't be-
tying
it
them?
won't be a problem at all.
I'm just looking at you using that right hand because that command, from your brain seemed to be automatic and seemed to work fine, didn't it? Do this again, so like you're playing a piano. Do you play the piano by any chance?
I used to a little bit when I was younger, but the left hand's 100%.
Yeah.
And I could do that all day long.
And you can't do that at all with that hand?
I'm sure I'm commanding my hand. It's very tiring. I'm going, come on hand. It's mentally exhausting even just to do that.
Yeah.
I'm really saying, come on.
Yeah. So, for example, do this. So the elbow, shoulder, you can swing around.
I mean, I've got 2 kids. I can load up.
So
weight.
it's just the fingers, literally.
It feels
what
the
about,
fingers and the wrist.
So do your wrists for me. And round and round. Round with that one.
I'm trying.
So wrist and hand. If I touch your hands, does that feel the same?
Doesn't feel any. Without being extreme, doesn't feel like I've had a stroke or paralysis,
No.
anything like that at all.
And so the sensation to you feels the same. You're not noting no pins and needles,
No,
nothing like that.
No, never at all. Else I would have come. Absolutely would have.
And
come
you can't.
I can command it, but I just can't translate it.
I think it's quite common in general practice for a patient to come and to have something that it's very hard to put a name on and to diagnose as something. I think whilst medicine is partly scientific, there's also a lot of art to it as well, if you like, and some of what we do is almost trial and error.
What I am going to do is ask for advice. We've got a kind of email advice line. What we need to do is get some sort of imaging or study on that. We can do a nerve conduction, and I just want to check if that's the right thing to do or if it's some other sort of test. So what I'll do is I'll get some advice and then I'll let you know. So I basically, I don't want to send you down the wrong route.
Yeah, no, it's a tough one.
But you've absolutely done right in coming to see us, and we need to look into it and find out what's going on.
Patients seem to appreciate it if you admit to your, lack of supreme knowledge almost and say, I actually don't know what's going on here. We're human at the end of the day, and we don't know everything, and as long as we're honest about that and admit that, I think they, on the whole, don't seem to have a problem with it, and I don't either, really, I don't think.
I shall get back to you in either tomorrow or Monday.
Cool.
Is that all right?
That's lovely. Really appreciate your time.
Okay.
Thank you very much.
No,
Take
good
care.
to see you. All right. Bye.
Sorry, I can do that.
Yeah, I was about to say. It's a good, strong handshake. So. All right. Bye.
Did you ever have TB when you were younger?
No.
Never. And just remind me, you were a smoker for quite a while.
Yeah,
weren't you?
and not only that, the job I'd done, but that's the coaling and
What job did you
that was
do?
a coalman.
Right.
You know,
Okay.
you're too young to remember.
No, I am, but I
You
know
carried
what
the
they
old
were.
coal on your back, the old, I mean, I'd done that for 25 years.
Did
I
you?
carried thousands of tons of coal.
Yeah.
But there again, that's the job you had to do, wasn't it? You either did them or
Absolutely.
well, somebody had to do them anyway.
I think what you're going through is related to all that.
Well,
and
oh yeah, I
smoking
do
in the
honestly. Oh
past.
yeah. I can't think of anything else really.
No. Do you bring up much phlegm?
Yeah, it's all clear. It is clear though, but it catches you in the night, and I've got such a dry mouth.
Really?
It's dry, absolutely dry. I have to drop of water, like a bottle of water. I don't have a glass of water.
Right.
Don't ever have a glass of water in your bedroom. I'll tell you why, because I always went with a glass of water in a bedroom, and I never turned the light on. I just picked it up and had a sip. And one night I just turned it on, and there was a nice big spider having his early morning dips blowing round in it. I'm never again. But anyway, I digress as usual.
So deep breaths. Good. Let's have a listen at the front now. Good. That's fine. Has anyone ever talked to you about what we would call what's called a chronic lung disease? Has anyone ever talked to you about lung problems that you might have had that have been there for quite a while?
Well, I've always known I've had a bit of
With that scarring?
bit of a chest, like,
Okay. What I was thinking when I saw you last time and what they saw signs of on the X-ray is something that we call COPD. Basically, as I say, it's long-standing damage to the lungs.
I can imagine that.
Yeah. What we need to do is do another investigation into it, which is a blowing test to give us a firmer idea. But no, if it's what it all points to.
Yeah.
It's not something that we can cure,
No.
but that doesn't mean we can't improve it. So, the test I want you to do is something called spirometry.
Oh yeah.
Once you've had this done, what we'll do is start you on some regular inhalers, which I think will help a lot.
I feel better already.
Hi, all right. Come
Yeah,
in, have
good,
a seat.
thanks.
Is it Wesley Stone?
Yeah.
Hi.
I'm going to South Africa for 3 weeks for holiday.
Yeah.
Yeah, so I just wanted to get a prescription for my paroxetine and Lamictal.
So you take it for the bipolar, is that right?
Yeah, well, I was diagnosed with bipolar when I was, 16 or 17, but I was taking a lot of drugs at the time. So, I mean, I've been clean now for four years.
That's
no,
great.
longer, 5
Yeah.
years.
Yeah.
I gave up drinking 2 years ago, so I don't even drink. I used to get very aggressive for no reason before,
Yeah.
Sometimes if I would feel a bit depressed, I would go and start punching up a wall, and then my knuckles would be all smashed for a couple of weeks. And so instead of cutting my wrists, I would do that rather,
But we're not,
Yeah, but that's...
Things are a lot better, aren't
Yeah,
they?
I mean, that doesn't even happen,
Okay.
So,
At the moment, are you feeling suicidal or like hurting yourself?
no.
No. Okay, well, that's good. And it sounds like you've taken away
a lot of the factors that were causing your mood swings, and that as a result of that it's become quite stable. Is that fair to say?
There's absolutely nothing wrong with him now. He never gets angry. He probably doesn't even need the tablets anymore because he's like perfectly fine.
So we're in a better place, aren't you?
Yeah.
Have you ever seen a psychiatrist in England?
No, because I haven't really felt I needed to, you know?
Yeah.
And that's the whole reason I changed my lifestyle over the last 5-6 years, you know?
Yeah, and you've done a great job with that.
Yeah.
From what you're telling me.
Yeah.
So shall I give you the medications as you normally take them?
Yeah.
And maybe you can come back and see me after South Africa.
Yeah, that will be good.
And we can make a proper go at reducing these medications. Getting the psychiatrist involved when we need to. Does that sound all right to you?
Yeah, that would be good. Yeah.
See when we've got some appointments available when you come back, and we'll take it from there.
Then, yeah.
All right.
So I'll see you then. Eh?
Yeah. All right. Take care. See you later. Bye. All right. Bye now. Bye. Come in. Have a seat. Nice to see you again. Yeah. How are you?
Yeah. Good. Yeah. I really just want to renew my medication, really, and.
Yeah.
But I must admit, Dr. Vajo, could you help me out with something to sleep, please? Because I think I'm I know my brain would just won't let me sleep, you know what I mean?
Okay.
I was sort of coming a bit insomniac and only getting sort of a couple of hours, you know what I mean?
Okay, why do you think you're not sleeping?
My brain just won't let me, you know what I mean? There's too much going on, like, I try to close my eyes and I'm not happy, you know what I mean? No.
Anything in particular going on in it that you think might be stopping you from sleeping? Is there anything upsetting you or stressing you?
Probably, yeah.
Okay, and what do you think those things are?
I can't put a finger on it, you know what I mean?
Can we just check you over a bit? Is that all right?
Yeah, sure.
All right, okay. Just want to take your jacket off for me. Just undo that for me.
I can't. I can't.
So you're living in a tent at the moment?
Yeah.
How much do you normally drink in a day, Stephen?
3 or 4 strong cans a day, yeah. I suppose, yeah.
And any thoughts of cutting back on your alcohol or getting a bit more help with it? Or does your outreach worker help you with that?
Yeah, well, it is from a drug and alcohol organisation, yeah, sure.
Have you got your outreach worker's number?
Yeah, I have.
Can I have it?
Yeah. Yeah, his name's Charlie. Sorry, mate. No,
do you want me to do it?
Yeah, if you can.
Yeah.
Yeah, see if you can do it. Oh, someone's right. Oh.
That's him.
Yeah. Is that Charlie?
Yeah.
Can I talk to him? All right, Charlie.
I can speak to him, actually.
Okay, no problem.
I can speak to him, actually.
Yeah, sorry, I'm with my doctor. He'd like to talk to you.
Oh, yeah, okay.
Yeah, I'm here now. Right. Okay. There you go.
Hi, is that Charlie?
It is Charlie, yeah.
Charlie, hi, I'm Dr. Buveja. Stephen's just turned up to see me today. I was actually just asking him to get me your number. I'm sure you might be a bit busy at the moment. Do you mind if I give you a ring maybe in the next couple of days? Is that all right?
Oh, that's fine. Yeah. Give me a call tomorrow.
Yeah, cheers, Charlie. Bye.
Bye.
Is it all right if I talk to Charlie about you?
Yeah, of course. Yeah.
All right. I think today you seem a little bit like as if you might have had quite a lot to drink.
I've had a bit to drink.
Yeah?
Okay.
Will you make an appointment to see me in about a week? Is that all right? And maybe next time just come with a little bit less alcohol on board, if that's all right. Just so that I can understand you, really. And that we're not jumping around. Is that all right?
Right.
Thanks very much.
All right.
Cheers.
All right.
So, welcome. I haven't met you before and think you were booked in to have a health check. Is that right?
Yes. Can I just give you the history? Then, it sort of makes sense of it.
Yeah.
I use my stress by using adrenaline. So I'm on overdrive the whole time. And my father shook. And when I do that, I don't shake.
Yeah.
But to eat a bowl of soup, it's impossible. And last weekend, could I stop my shakes so the worst they'd ever be? So I think it's a hereditary pattern.
Yes, it can
Rather
be.
than it being dementia
Yeah.
or anything. And I think I'm just so stressed I can't walk in a straight line. Signing my name now, you would have thought it was a spider on the website.
Okay.
So I, probably because I don't want to go down the Parkinson's line, dementia line, I now put in a program of exercising myself and walking much better. And I can't say in 3 weeks it's made much difference. Makes sense?
It does make sense. It does make sense. But it's an unusual presentation, and
Really?
yeah. What are your concerns that you think these symptoms might be?
I am concerned in case it's, I'm pretending it's not Parkinson's, but then I read the paper today seeing everybody's encouraged to go to their doctors and doctors get £50 right now. Oh, God, I've got years in the Times.
£55.
So I'm very conscious. I've put myself in a category that really I might not need to be there. I just need to relax.
Well, I think you've done the right thing, so you're not just living with it. Susan's a psychologist herself and is very aware of anxiety and stress, and she very much, I felt, wanted me to diagnose that was the cause of the tremor. I just felt I couldn't minimise the symptoms as she wished me to. Okay, so let's do some coordination tests. It's one of the ones that we ask patients to do is just put your hands straight out in front of you. So
I'm very good at that.
Yeah. And now open your fingers. Yeah, close a bit. Will you do it? Both of you stand in front of me. Put your fingers out, extend your arms and open your fingers a bit. And now could you close your eyes? Okay, I'm going to push the hands down and I want you to bring them back to the place that they're at. Now this time I want you to move between your nose and the tip of my finger as quick as you can. Good.
Oh.
Good. I want you to try and do that as quickly as you can. Quick. And the other side? That one's harder.
Much harder.
Yeah. Now try to do the walking and the balance, okay? So one of the simple ones is just toe heel, okay? Well done, good effort. Okay, so if you could just write that underneath, that would be great, thank you.
Far slower than I used to write.
Really? Yeah. And this arm was tremoring as well.
Oh, was it?
It was when your hand.
Can you tell more than that than the other things you've been looking at?
I think that did give me an indication of probably how difficult it is, being such a capable lady, to then have to work so hard at doing something like that. I was also slightly concerned about your toe walking.
Yeah.
That would make you quite at risk of falling as well as you get older. And it's fantastic that you're doing exercise, and we should really continue because that's going to help your balance. But
right.
You would be more vulnerable for falling as you got older.
I'm very conscious of walking now. I'm trying to keep a straight line.
Yeah. I think I should refer you to see a neurologist.
Right.
I can't diagnose anything just straight off.
Okay, neurologist here I come.
Neurologist, here you go. I'm so glad you've come.
Lovely.
Thank you.
I know, thank you.
You've been so candid.
I don't know how
and
you
open.
manage it, to give this amount of energy out to each patient. Just don't know how you do it.
Well,
I hope tomorrow's a rest day.
it makes it a more enjoyable job.
Mr. Libby.
Hello.
Hans, have a seat.
Yes. Oh.
Right, 6 months since I saw you last.
Was it? Is it 6
It
months?
is.
Yeah.
What's the problem?
Well, it's various things. I've been since August feeling really tired. You know, I wake up exhausted, and I keep getting, sweats and heart palpitations. But I think the most embarrassing thing has been. I have had very loose bowel movement, not diarrhea in the last 3 months, but it's comes out like a little worms, and I never feel I'm getting rid of it all. And sometimes, very embarrassingly, I've messed up my pants, you know, from farting and burping.
Your bowels have played up in the past, haven't they?
They've played up in the past, and this is slightly different in that before I used to get the runs and sweaty. Yes, my anus would get very sore. Every day I'd have to, well, I do have to clean it now, but it's not the soreness where I have to put Vaseline around the opening, you know, before I go to bed. So, yes, there has been problems with my bowels.
Okay, hands, just pull that up. Okay, so if you pop up on there.
Yeah.
So pull it up.
Yes.
And undo your waist.
Yeah.
And through your mouth, a deep breath. Right. Good. And this one. Good. Okay, fine. And relax.
You did examine me, you know, through the rectum, and I think you said my kidneys were okay. You were feeling them.
Yeah, prostate, I think, probably.
Oh, was it the prostate?
Yeah. You've got to have long fingers to feel your kidneys that way. So, has there been any blood in your diarrhea? Or the looseness, really,
well,
that you described?
I did wander once, and I was with a friend. We were on a walk, and suddenly I had to. This was in the country, and luckily I had to take my trousers down, and I don't think it was blood, but it was a vermilion colour, the feces, and it was wet, and that's happened about 3 times, where on country walks, I suppose. In fact, it happened last Saturday, where I had to go and quickly hide in this woodland whilst luckily, now what I do, I have toilet paper with me to...
Very sensible. Okay, your blood pressure is okay.
Oh, that's good.
I think we need to start off with making sure there aren't any abnormalities on a raft of blood tests. And I want you to come back and see me in 2 weeks' time.
2 weeks, yes. Yeah, I'm sorry to have all these symptoms.
Well, there's certainly a fair bit to get to the bottom of.
That's a bit of a pun, isn't it?
Could be.
Yeah.
But I'll see you in 2 weeks' time.
Okay, thank you, Dr.
Very good.
Come in. Hi there. Mr. Gomez. Hello, sir. Come on in.
You don't know about me, do you?
No, it's the first time we've met,
okay,
so no, I don't.
I've been a patient here for a long time, and I've discovered that I had cancer, liver cancer, a couple of months ago, but it's very bad. It's beyond surgery, so I'm going in towards, I think, the end of this month for the chemo. It's going to be a chemo Christmas.
Right.
I live alone, and I'm really struggling with the pain of this. It's extremely painful. It's those I'm taking. They're supposed to be every 4 hours, but I can take them every 1 hour, up to 1 hour if I want them. So I'm taking them every 1 to 2 hours.
Okay.
Sometimes I take them 3 and on the trot, 1 hour on the trot.
3
and then something, but I try not to, because I don't want to build up too much tolerance, because when I get to the end of all this, I'm going to, I'm going to end up taking buckets of it, and I don't want to do that. I've been in so much pain for the last couple of months.
And where is your pain at the moment?
Oh, it's all in this region
on the
here.
side of the liver. Okay.
Yeah, it's all in that region just there.
Okay.
I can't do anything like cooking, getting up, and the other thing is, look, it's my legs. This is all like water. She said it's water.
It does look like water, tight, isn't it?
My feet are like loaves of bread. I can barely get my shoes on. Yeah.
And sometimes when you have problems with your liver, the amount of protein in the blood drops, and then the fluid is just leaking out into the cells, and that's where you get the swelling.
Yeah.
So the idea, I think, probably behind the chemotherapy and all of those things is to reverse some of those side effects of the liver problems.
I hope so. It's, I don't know. See, I'm on my own. I'm taking care of myself.
Right.
So it's very, very difficult,
Yeah. Have you got any other support around?
At the moment, that kind of support, I don't want that support,
What kind of support?
Like coming around and cooking for me, cleaning for me, doing
Right.
it. I want to do that myself until I can't do it again. I've got liver cancer, not brain cancer. You know, it's, you know, I can still function, and I want to do that. Every day's precious. I don't want to give it up. I don't want to give up responsibility. I want to go down to the shop and get a loaf of bread.
Yeah.
You know, I want to touch it before I buy it. You know, is it fresh? You know what I mean? And I want to do these things still, and I don't want to take that away from me yet.
No.
You know, that's all I've got really. You know, the little things in life, which are the valuable things in life.
Precious.
You know, just take the dog for a walk on Wimbledon Common with the boy. You know, there's lovely little precious things. But you can't do it if you're in agony. I don't have very long, and I don't know. I'm going through all kinds of negativities. You know,
about the chemotherapy.
Yeah, once I'm in there, I'm wired up. That's it. They got me.
Part of my job as a GP, we deal with people who are who have terminal diagnoses, and it's always upsetting to be with someone who is going through those stages of life. You have to try and keep that emotion to yourself, and make this the interaction about them. What are you worried about? What worries you about? The agony of
it. This, I know.
The pain there.
I know what's coming. Yeah, I already know what's coming. I can feel it. But with the chemo, I can possibly push me up to a year, maybe beyond.
I'm always impressed by how people find resources within them to face the final days or weeks bravely.
I've got a severely disabled lad. He's blind. You know, I've been his sole carer for the last 16 years.
Right.
It's my son. Yeah.
Yeah.
And I need to prepare him because he's acquired brain damage. You know, he needs to be prepared for this one. You know, we protected him when his mum had cancer, and she died, and he was in a mess. You know, so now he's going to have no one there.
Does he have any carers or any?
Oh yeah.
He's got people around him.
Yeah,
okay.
he's with guide dogs. You know, he's got a guide. So
there's all that worrying you.
His welfare, his mental state. That's what worries me. Yeah.
And what kind of support, ideally, do you think he would benefit from?
Well, that's what I mean. I want about a year to sort of watch it. You know, to sort of, I need a year to get him prepared and to be prepared to be on his own now.
Yeah.
You know, there's things I need to settle and take care of. Yeah.
If you have a think, and if there's anything else you think you need help with, or we might be able to help with, will you just give us a shout? And we can work it out.
Yeah.
I'll give you the amounts, more of these, both.
Oh, the same again, yeah.
Yeah. I'll give you a bigger volume.
Yeah.
So that it doesn't run out.
Because I need to get this under control.
Yeah.
The management, the pain management. Yeah.
The pain we will get under control. The pain will get sorted.
Okay,
all right.
Thank you very much.
Nice to see you.
Very much, Doctor.
Give me a shout if there's anything else.
Thank you very
all right.
much. Thank you.
Take care now. Cheers. Bye bye.
Have a seat. Just trying to see when I saw you last. I think it was about 10 years ago. We've spoken on the phone since then, but obviously something fairly dramatic's happened. When did they formally tell you that it was lung cancer?
About a month ago.
I think you'd had a scan that was pretty suspicious.
I've had a scan, I've had biopsy.
Right.
It's a lot. I got fed up with it.
Right.
Really fed up with it.
Yeah.
Well, like chemotherapy, I didn't want to go through it. I refused it because I think they turn you into a zombie.
Obviously, without treatment or intervention, it's going to get worse.
Yeah.
The specialists wouldn't impose treatment on you that they thought had no chance of helping in some way.
I haven't heard of anybody having chemotherapy and all the rest of that survived. They all died.
Mm-hmm.
And even if they operate, there's no guarantee either.
No, no one can. If people promised you that it would be okay, they'd be lying. So
I won't believe them.
Who's the consultant that you've been under?
Dr. Poppet.
So have you seen Dr. Poppet?
No.
No. Is there an appointment?
On Monday.
I can't see any use of seeing him.
It would help me a lot.
Would it?
Yeah.
Oh, well,
because it's got to be a balance of the benefits against the negative effects. You know, if those side effects were short term, but we're going to give you another 3 years.
The side effects can make you vomit, lose your hair, diarrhea, and many other things.
Yeah.
I mean, I don't want to go through all that.
Well, you know, I can't make that decision for you, but I think that you shouldn't make that decision without having the input of a cancer specialist. You know, you're sticking your head in the sand a bit. The most challenging patients in general practice, I think, and those that generate the most emotion are situations where you can't make much difference to their outcome. By and large, though, the overwhelming emotion seen is of strength and courage. You've got the power, not me and not him. You know, it's your decision at the end of the day. But I think that we shouldn't make it without all of the right information.
If that's all it is, okay, I'll go and see him.
The pain, you don't need any painkillers?
All I use is Anadin.
You got, right. A lot of prescribable medicines, but I think we'll wait and see what Monday brings. Okay.
Thank you.
Peter,
Yeah.
So it's been a long time, but I think we'll be seeing each other fairly frequently.
Are all doctors healthy as well?
No.
Thanks
Okay.
a lot, Doctor.
Yeah. Okay. Thanks. Bye.
Hiya. Come through, Tony. How are you?
Well, thank you.
You look great. Like the trousers.
Thank you.
They're fab.
Back at uni, so.
Oh, right, okay. What course are you doing again?
English literature.
Right, yeah. I got a letter from Dr.
Ducci, yeah.
Yes. And you're on a waiting list for psychotherapy?
Yes, I'm currently seeing Dr. Healy at the Wandsworth Complex Needs every 3 or 4 weeks.
Right.
When I first found out I was diabetic, it definitely really threw my mental health, and I think I definitely wasn't coping for a period of 6 months, and I think I've got over that phase of, I think it's called burnout, when you stop testing and you stop really trying to look after it, and I think I'm testing 3-4 times a day now. I'm really trying to get a control of my blood sugar.
Yeah. Whenever a young person, particularly that has had a mental health problem, gets a diagnosis of type 1 diabetes, it's a very difficult combination. I haven't seen you when you're unwell with your mental health. And Dr. Ducci's indicated that you've had some really difficult times in the past.
I lost my mum when I was young, and I was initially born in South Africa, and now I'm at 15 social services intervened, so I've pretty much looked after myself since I was 15. So that's probably a lot of the issues. It was very early independence.
And were you very vulnerable at that time?
I think so. I think asking any 15, 16-year-old to look after themselves is a big thing, but I wouldn't have changed it because I'm here where I am now. And
brilliant.
Yeah.
I know from my experience of being a patient how much courage it takes to come and sit in the chair of a patient. It would have been about 15 years ago. I had an eating disorder throughout medical school, and it happened at a time when I was a single-handed GP running a practice on my own. I had 3 children under 5, and I was working very long hours with very little sleep. It was very difficult to sit in that doctor's chair day after day, year after year, telling people to look after themselves when I was crying out to be looked after myself.
I think you're very self-aware, and you're obviously resourceful, built self-reliance, but just let people in as well.
I went downhill pretty quickly until one day I could only get halfway to work and decided I couldn't do it anymore. And that's when we called our own GP and asked for help.
Is that everything?
Yeah?
Yeah.
I think it is with me.
Yeah.
Yeah.
Have a good day.
Thank you very much. Bye, Tony.
So how are you anyway?
I'm okay.
Okay. So last time I saw you, we checked your blood pressure and it was a little bit high, and then you very kindly went on to do some blood tests, didn't you? Okay. You look nervous.
I'm so sorry.
Why?
I try to overcome it without anyone knowing that I am very nervous, you know.
What are you nervous about?
I don't know really.
We're just feeling a bit anxious.
Yes, I am. And I know it's partly me, and I'm trying to sort of... Thank you for listening to me.
That's all right. That's what we're here for.
Thank you very much.
And we talked last time about your late husband as well, didn't we?
Yes. It's a lot of sorrow within me at the minute, you know. Although it's 4 years ago, and we had a wonderful time and everything. You know, I think he was told he had 6 months to live, you see, and it was devastating because we didn't realise that he'd got anything, you know, so dramatically wrong. He had pancreatic cancer.
Right. Okay.
And we were both kind of numb. The sadness of losing a second husband. The first husband, he went to work and died. I didn't get to him. I walked into the room and I said, I'm so glad I've arrived in time. No. Massive heart attack in King College Hospital. And that was shutting everything off, dealing with the children, you know, the heartbreak and not being able to cry at all, really. No tears. I'm talking now because I probably need to feel that I can have a little bit of help here from you know, and overcome it.
It's obvious it still plays on your mind, and it can be therapeutic talking to somebody.
Yes.
I mean, what do you think about having some counselling? Because we've got great counsellors here, and they could talk to you about your loss. I think it would be really helpful.
Yes. You know, the sadness and the overwhelming sadness. I'm going to cry in a minute.
Oh.
Sorry. No.
You can.
Sorry.
I think as a GP, we do have a very privileged position in that we learn a lot about patients that probably even their closest family members and friends don't really know, because it's often easier to tell somebody totally removed from the situation about what's going on, and to see what some people have to deal with in their lives is quite incredible at times. And if I can actually be a part of helping them through those difficult situations and see them on the other side, then it's incredibly rewarding. This is for you to fill in before you go and give it to the girl on the desk. It's about the counselling, okay?
Yes, thank you so much. I really appreciate it.
No problem.
How do I appreciate everything? You're very kind.
All right.
I don't know how to thank you.
Oh, anytime. See you later.
How are you doing?
Yeah, the tablets are a lot better now. Thank God.
Great.
Are they?
Really, really well, yeah.
Mummy, come here.
And I'm actually waking up in the mornings feeling like I've had to sleep.
Great.
I'm so happy with it. I'm so happy, yeah, I feel a lot better.
When are you going?
I'm going to Ireland in 3 weeks, and then we're going the week after. So, yeah.
And where are you going to be staying?
My sister's.
No, in New York.
Oh, New York. Oh, sorry. We're actually staying in a hotel just off Central Park.
It's a beautiful time as well.
It's lovely. I love it. Yeah. I love it. Yeah. And it's not. I don't like going away.
Do you feel frightened to go
I'm a little bit nervous because I am worrying, is something going to happen to tumour up in the air, you know?
There is a risk flying. It's different for every patient and at every stage of the illness, and actually for where in the brain the tumour is. It's to do with the pressure of the oxygen in the cabin.
The thing about it is I could be here, I could be walking down the road and something had happened, so it's one of them things, you know what I mean?
Before you go, I think I'd quite like to give you a letter as well to take with you, give a medical history just in case.
Please God, but if anything happens.
Yeah, I think what was going through my mind through the consultation was I can't make Fidelma better. But I think it was just so important a trip for her to make. It was very symbolic. She'd been given this as a 50th birthday present at the beginning of the year when she was totally ignorant that there was a brain tumour growing. Oh, I'm so pleased you're going.
Yeah, no,
I'm
really
so pleased.
No, they've all been given out to me. My mum, she's
Of course they
go,
would.
go.
Of course they would.
Do you want to give Dr. Ham high five?
Wow, that's stinging.
Come here, you've been
You
so
have a good time.
You've been so good to me, so you have. Really, really good.
Have a good time.
Yeah, I will. And you
Have a good time.
I'll see you. And
Yep.
if there's anything you want, let me know.
Yep.
I
Yep.
did tell you that.
You did tell me that. You did tell me that. Right, lovely to see you. Thank you. All right, bye. Bye.
Okay. So you've had a rough few days, haven't you?
Yeah.
What does the pain feel like to you?
As if I've been beaten.
Really?
What about when you lay down? You can't lay down.
I can't
'cause
lay
of the
down on
pain.
my back. I can't put my back down.
Do you want to take your jacket off?
Yeah.
And if I press... Oh,
yeah.
It's sore, isn't it? Oh, it's sore all along there, isn't it?
Oh, yeah, it's bad.
Goodness me. Do you want to lie down? You can show me where it hurts. Might be useful. Because obviously we know you've got osteoporosis and your back is curved. I mean, sometimes you can get little fractures in the spine. Where's that hurting you?
All right across there.
Where's that sore?
All across there. See, I've only got to move. I can't go on my back.
No.
Because of it, but it's hurting across
of
here.
the pain at the front.
Yeah.
It's difficult for me sleeping and everything. Oh, and then it's agony.
There's obviously pain in the chest there, which looks like it's coming from the muscles and the bones rather than coming from the lungs. Well, it's difficult to know. I mean, you can get an inflammation of the cartilages there called costochondritis. It's like an inflammation of the costal cartilages, basically. Come on, you sit up, make yourself comfy.
See, I haven't got any movement like that. I'm in agony all the time. I went to the hospital, but I mean, they weren't particularly bothered.
They were bothered, Mum. That's why they gave you the painkillers and the antibiotics.
But you've no idea the pain I'm in.
We do.
I can see.
It's all so depressing. Oh. See, it's only that I sort of pulled myself up then.
And it gets you. There is always the possibility of, Queen Mary's Hospital has Bryson White ward, which is like a rehabilitation type ward. If we're finding it difficult to manage the pain at home, I mean.
What about calling it respite?
I mean, is it something that you would consider?
Don't know.
You're in pain, Mum.
I don't want to go in hospital.
But it's not like going into an acute hospital. It's it's like it's more of like a rehabilitation type unit. Mrs. Emanuel I've known for a long time, and she is a fiercely independent lady. She always comes in looking immaculately dressed. Her house is immaculate, and I think she's very proud of that and wants to be at home for as long as possible. But things had really come to a crisis point because unfortunately she's recently been diagnosed with Alzheimer's disease, and we weren't sure whether she was remembering to take her painkillers. I guess the benefit of going somewhere like Bryson White would be that we could hopefully get you better quicker.
Yes.
Should I make some enquiries anyway?
Make some inquiries.
Yeah?
I don't really want to. I want to stay in my own home.
But, Mum, you need assistance. You do need some
Some
help.
help.
At the moment, you need some help.
I mean, I think if I was in Mrs. Emanuel's position, I, like her, would probably be the same. I mean, no one wants to lose their sense of independence and autonomy, and to feel that other people are making decisions for you. I'm not saying it's going to be forever.
No, no.
So leave it with me. Am I able to get you on the phone later, John?
Yes,
Yeah.
you've got my number.
Yeah, I've got your number. All right. All right, do you want a hand?
Any movement?
You got it. There we go. Okay.
Bye-bye.
See you later. Okay, see you later.